98.1.
Smooth health on the drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Hello and welcome to Smooth Health on the Drive, brought to you by Evercare Hospital Lekki, right here on Smooth 98.1. So on the show today, we're talking about something that is a very important health issue that affects women. We're talking about uterine fibroids. We're looking at the prevalence, symptoms, and management of uterine fibroids.
That's right. And joining us live in the studio today, we have Dr. Jude Nnorom. He's an obstetrician at Evercare Hospital. Hello, doctor. How are you doing today?
Fine, thank you.
Do you want to give
our listeners?
Do you want to give a brief background of our doctor?
Oh, yeah, definitely. So, Dr. Jude is a consultant obstetrician and gynecologist at Evercare Hospital. He is a fellow of the West African College of Surgeons. He had a medical education at the University of Port Harcourt and residency at University of Abuja. So, you and CB went to the same school.
No, I didn't go to university. I'm just from Port Harcourt.
Okay, also he taught at the Abuja Teaching Hospital and also at the FMC Lokoja. Now, in his 15 years of practice, he has been privileged to work across several government, private and missionary facilities and NGOs across Nigeria. Also, he has a passion for positive patient experience and satisfaction, as well as clinical excellence, and has had several publications in local and international journals, as well as participation in professional continuous medical educational conferences. And he focuses on gynecological surgeries and endoscopy, and also assisted conception.
Thank you so much for coming, Dr. Jude Nnorom.
Thank you very much.
As always, you're welcome to be a part of the show. If you've got any questions or any comments for our guest doctor, please share them with us on WhatsApp. The number is 0809 444 0981. Or you can actually give us a ring. The telephone number to call is 01 4489 981. So, Dr. Jude, let's dive straight in. What are uterine fibroids?
Yeah, fibroids are benign tumors of the uterus. The uterus is the womb of a woman where the baby stays, where she carries her baby. So they are like swellings, they are like growths that develop in the uterus of women and cause a lot of symptoms for women and cause discomfort and affect the quality of life, and women affect their productivity, reduce their hours at work, and also affect fertility sometimes for women. So it's a common benign tumor in women, and is quite common in our environment, especially we as Black Africans.
All right. Thank you so much for that, doctor. But I'm sure that a lot of people are wondering what causes uterine fibroids.
The cause of fibroids are actually not known, but it's been linked to some genetic and hormonal interplay in women. And we also have factors which have been identified as risk factors for uterine fibroids in women, which include nulliparity. Nulliparity, by that I mean women who didn't get pregnant early enough, or who are not carrying pregnancies. Then also, of course, there's a family history, can run in families because there is some genetic predisposition. Then, of course, the African race, blacks, is much more common in us. Then for women who are also having their menses very early menarche, or those who have menopause late, because of the longer exposure to some of the female hormones, estrogen in particular. So these are some of the risk factors that have been associated with fibroids and genetic predispositions as well.
All right, you did say something about black women. So does this mean that Caucasian women do not suffer from these uterine fibroids?
Yeah, well, it's not as common in Caucasians as we have in blacks. So it's much rarer. Just like Caucasians also have some disease conditions that are much more commoner in them than in blacks. So it's much more commoner in blacks, and not as common in Caucasians.
All right. So a lot of ladies, particularly you hear this among women in their 30s, sometimes in their 20s, they talk about fibroids, and then for older women as well. How can a person tell? What are the symptoms?
Yeah, so the symptoms of fibroids, sometimes the women may have fibroids and they may not know because they don't present with any symptoms. As the ones we say they are asymptomatic. Then the other symptoms which usually bring women to the clinics are when they notice that their menstruation is longer and heavier. Maybe in terms of the number of days they are now menstruating, or the quantity, the number of pads they are using has significantly increased. Then some women may also notice that their menstruation is becoming a lot more painful, what we call dysmenorrhea. And some other women, especially during intercourse, they may also notice that they are now feeling pain during intercourse. Some women may also notice like a swelling in their lower abdomen, feel bloated in their lower abdomen. Then some of the also other complications, other symptoms that women may notice are pressure symptoms from the fibroid, which may affect the way they urinate, not able to empty their bladder completely, having difficulty passing urine, having constipation. So those are some of the symptoms from the pressure of the mass of the fibroid in the pelvis. Aside that, some women also may also notice that they may be having difficulty in conceiving for women that are trying to achieve pregnancy. So those are some of the things that women may start experiencing and need to have a need to have a consultation to make such diagnosis.
All right. Well, thank you so much for that, Doctor. If you just joined us, by the way, this is Smooth 98.1. Smooth Health is what you're listening to. And today we're discussing all about, basically fibroids. We're talking about uterine fibroids, and we're talking about prevalence, symptoms, and management of uterine fibroids. So, Doctor, let's circle back and talk about the risk factors. So we've talked about the symptoms, we've talked about the causes, and we've talked about what uterine fibroids are. So who would you say is at risk of uterine fibroids?
Yeah, well, every woman, especially women, black race, who are in their reproductive age. By reproductive age, I mean women from as young as early 20s to close to 50 at risk. There are also sometimes when even women who are more than 50 may still have fibroids. Women at that reproductive age group who are Africans, women who are maybe not, who have not given birth, they are also at increased risk. And women who have their menstruation early, or women who are having delays in getting to menopause, delayed menopause. So such women have risk of having fibroids. And it also can run in families. If your mother or your sister has it or has had it, you may also be at risk of having this condition. You may need to come to have a check.
All right. So speaking about these uterine fibroids, are there different types, or is it just one case?
Yeah, so actually not different types, but what we have, what we try to describe is different types in terms of location. So the fibroids can occur in different locations in the uterus. So sometimes you see these fibroids occurring because the uterus has different layers. On the outside of the uterus, the ones we describe as subserous fibroids. So those ones tend to occur more on the outside of the uterus. Then we also have those that occur within the muscle of the uterus, with the ones we call intramural fibroids, and we also have those that occur within the cavity. That's where inside the womb where the baby stays. Those ones we describe as submucous fibroids. Then we also have those that grow, with a stalk on top of the uterus. We describe as pedunculated fibroids. So these are the fibroids that occur within the uterus. We can sometimes also have fibroids occurring at the neck of the uterus, the cervical fibroids, and some other fibroids around the pelvis, which are not as common.
Oh, wow. So there's a lot of them then?
Yes.
Okay, now it will lead us to diagnosis. But before we move into diagnosis, I'm sure that the listeners out there would love to ask you questions. So if you've got questions for our doctor today, please call the number 0144899981. If you're a lady, if you're a gentleman, you have questions and you want to, know more about this conversation or know about this discussion rather, please call the number 0144899981 or just send us a WhatsApp message 080944400981. So doctor, now that we know that there are different types, can we talk about how they can be diagnosed? Because I think earlier you mentioned that, some people carry it around and they don't even know. So how then can this be diagnosed?
Yeah, so the diagnosis starts from when a woman starts having some of the symptoms that we have described, like your menstruations is now a lot heavier and longer. She's having a lot of pelvic pain during intercourse, some pressure symptoms of feeling that there is something growing in her tummy. She will need to present to the gynecologist who will examine her, and then we will need to confirm the suspicion during examination with investigative tools such as doing ultrasounds, pelvic ultrasounds, abdominal pelvic ultrasounds. Sometimes we may also need to do CT scans and MRIs to further describe the fibroids. So that is basically how the diagnosis is made. Yeah, so for some women who may not have symptoms, when they go for checks, maybe routine pelvic scans, and is discovered incidentally as a finding. So those are also another way that it can be diagnosed.
All right, we could see the phone lines blinking when the doctor is speaking, but if you want to give us a call back, you can do that right now. 0144899981. That is the number to call to speak with Dr. Jude Nnorom. We're speaking about symptoms, prevalence, and management of uterine fibroids. We've got a question here, and this is coming in via WhatsApp.
This one here says, which of the fibroid types is the most and least risky to fetus?
Yeah, so risk to fetus. Yeah, so for the submucous fibroids, because they are within the cavity, they tend to cause more of heavy menstruation much more commonly, and also tend to increase the risk for women having miscarriage much more than the other types. Though the other types can still predispose women to having these same symptoms, but the submucous ones tend to cause more of these heavy menses and more of risk for miscarriages for women, and preterm labor for women who are pregnant, early delivery. Yeah, so those are some of the things that it predisposes women to.
All right, so we'll take a quick break, and when we return, the conversation will continue with Dr. Jude Nnorom. And if you've got more questions, you can, of course, get in touch with us. This is Smooth Health on the Drive.
This is Smooth Health on the Drive.
The global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
luxury music.
Love music. Love music. Love music. Love music.
Love music.
Love music. Love music. Music. Music.
Love life. Love life. Love life.
Love Smooth 98.1.
Cause I feel so high, I'm reaching out for your sky. I feel so high when I'm touching your sky, baby. I feel so
You're listening to Smooth Health on the Drive, brought to you by Evercare Hospital, Lekki. Special guest is Dr. Jude Nnorom, an obstetrician at Evercare Hospital. We're speaking about prevalence, symptoms, and management of uterine fibroids. As always, we'd love you to be a part of the conversation. If you have any questions or any comments, please send them through. You can send them to us via WhatsApp 0809 444 0981 or give us a call 01 4489 981.
Here's one from Bibi from Lekki. She says, thank you, doctor. I want to know if there is any dietary inclination or diet choices that can predispose someone to fibroid. And also, Aisha Tilala comes in with this one. She says, is fibroid surgery risky? If not, why would anyone die after having a fibroid surgery? Lost a neighbor last month after having surgery to get fibroids removed.
Yeah, so in terms of dietary inclinations, there is actually no scientific evidence so far to prove that any particular diet predisposes to fibroids or improve fibroid risk. Though people have, there have been stipulations, but there is no scientific evidence so far. Yeah, so just like for the second question, just like any surgery, yeah, there are possibilities of complications from surgery. So that is clear. And fibroid surgeries can be quite major, especially for fibroids that are very large. Yeah, so there are possibilities of complications such as bleeding during surgery and after surgery. So usually measures are put in place to reduce this risk. And these measures will start from working up the patient, making sure the patient is fit for surgery, timing the surgery, and making adequate plans to reduce the risk of bleeding during surgery, and if there's bleeding, correct the bleeding during surgery. And also, maybe if there's need to transfuse the patient with blood during the surgery, such is also done. And again, monitoring the patient immediately after surgery, at least for the first 1-2 days, to be sure that the patient is fit and recovering well, and there's no cause to worry.
All right. Anne has a question. She says, can fibroids degenerate and bleed out on its own without surgery?
Yeah, fibroids, when we talk about degeneration, those are some of the changes that can occur in fibroid during pregnancy. So they don't actually degenerate and come out on their own. So degeneration is a term reserved for some of the changes which fibroids can undergo, especially during pregnancy. So in terms of fibroids shrinking or coming out on their own, it doesn't occur that way unless we have some fibroids that are like polyps, maybe occurring in the cervix or coming out from the vagina, and sometimes the undergo some change and be falling out, coming out small, but does not mean that it comes out on its own. Yeah, so what she's trying to describe is maybe some people having increased discharge, vaginal discharge for some fibroids that are in the vagina and cervix and coming out as polyps. Yeah.
Okay.
So those are where you see things like that.
All right. So, Dr. Jude, how exactly can these fibroids be treated or managed, at least?
Yeah, so we have various ways of managing fibroids, and it depends on their location, the number, and the sizes. So for some women who do not actually have symptoms, the ones that are symptomatic and they are small, We usually may not do anything about them. We just observe them, keep doing serial scans at intervals every 3-6 months or yearly to monitor them. Then for those that also having symptoms, we have options which include medical treatment with medications, tablets, injections, and these are basically to address some of the symptoms that these women have. And these treatments are usually temporary treatments to improve some symptoms that the women have. Then the definitive treatments are surgery, which can be open surgery where we make incisions, on either on the abdomen to remove these fibroids. We call them myomectomy. So these are done specifically to remove the fibroids. Then there are also times when we have to remove the uterus with the fibroids, hysterectomy. But this is reserved for women who have completed their family size, who do not want to have more children. Yeah, so for those who still wish to have children, the myomectomy is like a fertility or sparing surgery, such that it preserves the uterus. Then we also have other endoscopic surgeries where we do laparoscopy or hysteroscopy to address fibroids, depending on their sizes and locations. Then, of course, there are also new technologies and techniques used to address fibroids, such as uterine artery embolization and the magnetic resonance guided focused ultrasound treatment. So these are all the modalities that are being used to address uterine fibroids, depending on their sizes, the location, and also the desire of the woman, fertility desire of the woman.
All right. Thank you so much for that, Doctor.
And symptoms.
And symptoms. Okay, got another question here. This one says, Dr. Jude, please explain the risk factors that make fibroids come back after surgery.
Yeah, so that recurrence of fibroid is one thing that has been noted. It occurs in some women, a few percentage of women who after surgery, after some years, say 5 years, 10 years, will notice some of these fibroids growing back. Yeah, sometimes they usually may not be as big as it was before the surgery. So usually some of the risk also include women who do not get pregnant after the initial surgery. So many a times we usually recommend, especially for women who is not so causing too much symptoms, for women to maybe want to wait to do these surgeries around when they are ready to start having children. So that's a risk. And then there are some times when there are some very small fibroids that were not removed that tend to still grow back, and they may still grow back and get bigger. So these are some of the risks along the other risks that we've mentioned before.
All right, thank you so much for that, Doctor. Well, we're almost out of time, but real quick, let's talk about the prevalence of uterine fibroids in recent times. Now, like you've mentioned, you said, 3 to 9 times it's more common among black women of African descent more than Caucasians. Now, the question is why? And also, why is it common amongst, African women, Nigerian women, black people?
Yeah, so this we have linked to genes. So there have been studies that have been done to say, okay, since we are noticing this thing more in black population, why this? And it's been linked to some genetic predispositions. Some particular genes that are commoner in blacks have been associated with fibroids. So that's the reason why it's commoner in blacks. So it's genetic.
Okay. And I mean, speaking about the prevalence now, a lot of people are more aware of these uterine fibroids. So why do you think a lot of Nigerian people are still sort of afraid of these fibroids and wouldn't get proper treatments after diagnosis?
Yeah, I think the reason is many a times the definitive treatments are actually surgery. So a few people are afraid of surgery. Yeah, people try to avoid going under the knife as much as possible or having any procedure which may predispose them to possible risk and complications, which that's one of the reasons that is quite understandable. Then again, there are also myths where people believe that they shouldn't do anything about it, they shouldn't remove anything from their body. Then as well as possibilities of also funds, because treatments and surgeries require money. So people may, in some areas, you see people who cannot afford these surgeries and seeking for help, or maybe they don't have insurance and can't pay out of pocket. So these are some of the reasons why people tend to carry these things for as long as,
Is there any chance that fibroids could, especially if they're coming back, could it, cause any form of cancer whatsoever?
Yeah, fibroids can actually undergo cancerous change, but that risk is very rare. It's less than 1%. In fact, less than 0.001%. So,
oh, wow.
So it's there, but it's a very rare incidence of fibroids undergoing cancerous changes. And that occurs, it tends to actually occur in women who are older, maybe in their late 40s, 50s. And the suspicion is when all of a sudden fibroids start growing very large suddenly. You're monitoring fibroids, all of a sudden, it starts growing so large. Or women who are already in menopause and they start having fibroids growing so large, that will raise a suspicion that this thing undergoing these cancerous change. But it's a very rare complication. Yeah.
All right. Thank you so much for that, Doctor. Just before we let you leave, for those who just joined the show, we'd like for you to, leave us with some parting words and advice to our listeners. By the way, we're talking about uterine fibroids. So we're taking a look at the prevalence, symptoms, and the management of uterine fibroids. So, parting words for our listeners out there.
Well, the parting word is, I think people should not be afraid. They need to, when you have these things and it's affecting your quality of life, you need to seek for help. You need to come to the clinic, have consultations, and these procedures and surgeries are also being done very safely in areas where the expertise is there and where they have all the facilities. So we do these surgeries every day, and people should not be afraid. So they should come and have these checks and procedures done. And
So how can our listeners contact you at Evercare Hospital?
Yeah, the listeners can reach Evercare Hospital at 0813-985-0710 or send an email to info@evercare.ng.
And the location is
Evercare Hospital, Lekki Phase 1.
Okay.
So that's at around Admiralty Way?
Yes.
All right. So Evercare is at Admiralty Way, number 1 / Admiralty Way, Bisola Drusimeti Drive, Lekki Peninsula Scheme 1.
And the website is www.evercare.ng. Thank you so much, Dr. Nnorom Jude, consultant, obstetrician and gynecologist at Evercare Hospital, Lekki.
Thank you very much, and good evening, listeners.
And that's it for Smooth Health on the Drive. Do stay tuned. There's a lot more to come on the Smooth Drive.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness
Every
of cancer.
Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.